So I think the first thing to know is it's really important to recognize that your voice needs care and maintenance.
So if you've been experiencing hoarseness or a change in your voice for more than 2 weeks, that's when you should seek care, and you need to see somebody who's able to take a look at your vocal cords. It's very common for us to lose our voice when we're sick or have allergies or something that come up. Those symptoms shouldn't last more than 2 weeks, and you shouldn't just assume that it's going to get better.
The voice works, like so many other things in the body. We don't really put any thought into it. We just talk and our voice comes out. But it is a remarkably complicated process.
The person you should see is an otolaryngologist or a laryngologist. An otolaryngologist is a very fancy word for an ear, nose, and throat doctor, or ENT as we often call it. These are physicians that have the ability and specialize in the ears, nose, and throat and are able to look at the vocal folds in the office. A laryngologist is an ENT physician who has spent an extra year training to specialize just in the T or the throat of ear, nose, and throat. And they can often have some additional diagnostic tools in their office in order to more precisely diagnose your voice problem.
Typically, that's seeing an ear, nose, and throat doctor that either specializes in voice or has the training to take care of people with voice problems. It involves often seeing another member of our team, which is a speech-language pathologist, like my colleague Joanna Lott here, in a multidisciplinary evaluation. That means seeing both clinicians, both providers at the same visit in order to fully understand the problem that is happening with the voice and determine treatment options.
So typically when someone comes to a voice clinic, you want to come a little bit early. There are often many forms to fill out, things that are typical in most patient visits, past medical history, patient forms, but also in a voice encounter, one is often filling out what we call patient-reported outcome measures. So these are forms that allow us to give a numerical score to things like voice, swallowing impairment, if you have a cough, if you have a feeling of a lump in your throat, if you have any reflux, for example. And there are various scores that have been validated that allow us to determine if your score is abnormal, if it's normal, if it's improving or getting worse from visit to visit.
Like most things in health and medicine, it's much easier to prevent problems than to treat issues once they arise. So concrete things that you can do include, number one, staying hydrated. This means drinking plenty of water throughout the day. And certainly if you are consuming beverages such as caffeinated beverages or alcohol, then you should increase your water intake to keep that balanced. It's also really important to stay away from irritants. Your voice and your vocal cords are very sensitive to smoke, so don't smoke, and try to avoid secondhand smoke as much as you can.
Any types of issues on the brain end or nervous system problems can also affect how the voice is working.
We see a really wide variety of different professions in our voice clinic, and anybody can develop a voice problem that should warrant evaluation by an ear, nose, and throat specialist.
In addition to the structure and function of the vocal folds and the laryngeal anatomy, we're looking at how the patient is compensating for the voice problem. So they're bringing in muscle tension in the muscles of the throat or the neck that could potentially be decreased with working with a speech pathologist. And then we're even able to do some what we call stimulability during the exam, where we would have the patient make some different sounds and see if that actually affects what we're seeing and improves the voice quality at the same time. And that gives us a whole lot more information about whether this is a structural issue that requires intervention, medical or surgical, or if perhaps it's something that can be more of a behavioral therapy treatment with me or one of my wonderful colleagues.
If you know that you're partaking in an activity that requires more voice use, such as performing in a show or giving a presentation at work or coaching your kids' basketball game, then make sure that you rest your voice in the time surrounding those activities.
The vast majority of the patients that I see are teachers, and that makes perfect sense because teachers are using their voices all day long, every day, trying to keep control of their classrooms and trying to educate the youth of America. And they oftentimes have to use their voice in ways that is maybe not the most productive way to communicate.
Sometimes a patient comes in and they're just worried about their voice, but then once they see the examination, they're actually quite reassured and they go along their merry way. But often, patients do require some sort of therapy, rarely surgery, but when it's indicated, we have a pretty lengthy discussion about what that will entail and the various things that will be required, not just after surgery, but before surgery. Often therapy will be required before surgery and after surgery to make sure the patient gets the optimum outcome.
The other thing to keep in mind is that there are no standards for how much voice use is okay. So we have standards in other professions for how long you can stand, how long you can sit, how much you can lift, what sort of volume of sound you're exposed to. None of these types of standards exist for voice use. So because of that, we do see these patterns, and those are the types of patients that we really love to take care of, because it's important for us to protect their voice quality so that they can continue to do their job for the duration of their career.